Today's journal entry, we're talking about transfers and transports. I have had the privilege in the last couple years to be a part of several now. And I call it a privilege because we learn from these experiences. So, although they're not the outcome that we as midwives want to see, it is for the best, and we're very grateful to have somewhere to transport our clients to when we need to. Only a couple of those were emergent, a couple were for Pitocin augmentations for failure to progress. When collaborating with hospital-based providers, here in Washington State, it's a very midwife-friendly state. Here in my county, it's not a midwife-friendly county. There's several midwives here, and we have several hospitals that we can send our clients to. And none of them are very receptive to clients who are transferring from out of hospital. They're more receptive with clients who are coming from the birth center rather than from a home birth. What I've seen, what I've learned from when dealing with some hostility that comes from hospital-based providers that are on the receiving end, they really think poorly of midwives when the midwife has accompanied the client to the hospital and they have real poor records or charts are out of place, or there was a situation once where we didn't get all the charts put together in a non-emergent transfer, and decided to do kind of put things together as we went to the hospital, which was a drive away. And then when we got there, all of our charts were not in order and things were like kind of messy. So reporting off to the doctor in charge of the situation, he was not pleased with that. So I think my biggest lesson in all of transports and hospital transfers is just to have all your ducks in a row, because it looks better for whoever is going to be seeing you on the hospital end, because they're used to their hospital practice and how things go, and which is not our style as midwives, not at all. So I've worked with a midwife who does paper charting. It's much easier to have messy charts with paper charting. And then I have worked with midwives who use, sorry, fixing it's unfixable, who use electronic charting, and that's easier to keep everything in its place, but sometimes will lack some of the details that paper charting offers. That's what I've noticed. So in case of a transfer, it's really easy to just like fax over those records like right as we're talking. Whereas with paper charting, you're either needing to photocopy things or send the client with physical papers. There have been times where the hospital has not allowed a midwife to accompany the client. Now things are getting a little more relaxed with COVID guidelines, but a year ago, the midwife couldn't attend the client in case of a transfer, only at the front door to pass off records. So now things are a lot better. But in the future, in my practice, I can see myself charting electronically versus using paper. Paper transfer forms can be really handy though. Sometimes those are good to have just to like pass off, and it's so easy to look it up. You don't have to go to a computer to see, quick demographics on this client. So I know that's been useful for EMS and the receiving provider at the hospital. I think when it comes to interprofessional collaboration, it's just good and healthy to practice open communication and not to hide anything that has been done, because I feel like doctors looked at midwives around here, maybe not everywhere, just kind of quizzically, like, what did you do wrong? Assuming that something has been done wrong. So being really open and honest about what's happened, what worked, what didn't work. I feel like that honesty is really healthy. And also treating everyone with respect. Like, we need these hospital-based providers. We're very grateful that our client can be going to a hospital when they need a hospital. So treating that doctor on the receiving end, the nurses, with respect. Like we teach children, respect begets respect. So if I'm not willing to treat the receiving doctor with respect, why should he or she be treating me with respect? I think that's an important thing that I have seen a couple of times in a couple of transfers where respect was not given in either situation. And it does not benefit the client. That's the thing. It's not just like the doctor and the midwife beefing it out. It influences how the client is treated. So for overall client care, it's really important that the midwife and the doctor communicate openly, honestly, and with respect. Anyway, those are my takeaways from transfers that I've seen.